Everyone, myself Harshvardhan Pawar. My topic is beta-lactam antibiotics. Beta-lactam antibiotics contain beta-lactam ring, so they show similar chemical structure. They have high efficacy and low toxicity. They are frequently prescribed drugs. They work by inhibition of cell wall synthesis. Beta-lactam ring. The antibiotics which contain beta-lactam ring are beta-lactam antibiotics. They include penicillin, cephalosporins, monobactams, and carbapenems. This slide shows about the penicillin ring. The penicillin. History. Sir Alexander Fleming discovered penicillin from Penicillium notatum. Penicillin is now obtained from fungus Penicillium chrysogenum. The penicillium nucleus consists of fused thiazolidine and beta-lactam rings, to which side chain are attached through a amide linkage. Penicillin G have benzyl side chain at R in the original penicillin used clinically. Mechanism of action of penicillin is bactericidal. They inhibit cell wall synthesis, rapid action on growing and multiplying bacteria. More effective for gram-positive bacteria. In gram-positive bacteria, thick peptidoglycan layer is easily accessible to the beta-lactam antibiotics. In gram-negative bacterial cell walls consist of alternating layer of lipoprotein and peptidoglycan. This may be the reason for high susceptibility for gram-positive bacteria to penicillin G. Mechanism of action of beta-lactam antibiotics. Beta-lactam antibiotics bind to penicillin binding proteins. They inhibit cross-linking of peptidoglycans, which produces cell wall deficient bacteria. Cell wall deficient bacteria are hyperosmotic. Due to cell wall deficiency, they undergoes lysis, produces bactericidal effect. The beta-lactam antibiotics inhibit the transpeptidase so that the cross-linking does not take place. These enzymes and related proteins constitute the penicillin binding proteins. When susceptible bacteria divide in the presence of beta-lactam antibiotics, cell wall deficient forms are produced. Because the interior of the bacteria is hyperosmotic, the cell wall deficient form swell and burst, produces bacterial lysis. Penicillin G, antibacterial spectrum. Gram-positive bacteria, the gram-positive cocci, streptococci, staphylococci, gram-negative cocci, Neisseria, gram-positive bacilli, anthracis and diphtheria. Bacterial resistance. Many bacteria are inherently insensitive to penicillin G because in them the target enzyme and penicillin binding proteins are located deeper in the lipoprotein barrier. When penicillin G are unable to penetrate or have low affinity for penicillin G. The primary mechanism of acquired resistance is production of penicillinase. Penicillinase is a narrow spectrum beta-lactamase which opens the beta-lactam rings and inactivate the penicillin G. So it cannot produce its action. Some resistant bacteria become penicillin tolerant and not penicillin destroying. Pharmacokinetics. Penicillins are acid labile, destroyed by gastric acid. It is given by intramuscular or intravenous route. It is widely distributed. Penicillin G does not cross blood-brain barrier, but in meningeal inflammation, it crosses blood-brain barrier. Urinary excretion occurs by tubular secretions. Adverse effect. Some minor reactions like oral nausea and vomiting, intramuscular, local pain, erythema and induration. Intravenous of benzyl penicillin, thrombophlebitis. Intravenous of procaine benzyl penicillin, anxiety, mental disturbances, paresthesia and seizures. Hypersensitivity reactions like skin rash, urticaria, fever, bronchospasm, dermatitis, anaphylactic shocks, seizures on high doses are seen in patients. Uses of penicillins. Streptococcal infections, in pneumococcal infection, in meningococcal infection. It is also used in gonorrhea, syphilis, diphtheria and tetanus and gas gangrene. Its prophylactic uses are in rheumatic fever and bacterial endocarditis as well as agranulocytosis. Now we will see MCQs. Which of the following is not a type of beta-lactam antibiotics? Option A penicillin, option B ciprofloxacin, option C amoxicillin, option D cephalosporin. Answer option B ciprofloxacin. It is included in fluoroquinolones. Second, beta-lactam antibiotics works by targeting option A bacterial cell membrane, B bacterial DNA, C bacterial cell wall, option D bacterial ribosomes. Answer is bacterial cell wall. Question number 3. What is the primary mechanism by which the bacteria develops resistance to beta-lactam antibiotics? Option A. Inhibition of bacterial protein synthesis. Option B. Production of beta-lactamase enzyme. Option C. Disruption of bacterial cell membrane. Option D. Inhibition of bacterial DNA replication. Answer. Option B. Production of beta-lactamase enzyme. Thank you.